And there may be some time afterwards for Cameron and Jake to answer questions. We'll see how we go with time. Our next speaker is someone who will bring us the Australian experience, Dr. Cameron Parsell. He's the Program Leader, Social Wellbeing, Health and Housing, Institute for Social Science Research at the University of Queensland. And his primary area of research is actually homelessness, supportive housing and the broader social welfare programs aimed at addressing social disadvantage. Some of the questions about social security relate to that as well. He is a Senior Research Fellow funded through the Australian Research Council, and he's also the Associate Editor of the Australian Journal of Social Issues, and he's a Policy Advisor to the Australian Council of Social Services. Can you please welcome Cameron to the stage? Thank you.
Good afternoon, everyone. Thanks very much for having me. Thank you for the warm introduction, Peter. Thank you to the Dunstan Foundation for the invitation to travel up today. It's a really great privilege. I've been banging on about ending homelessness for about 15 years when I first worked in a homeless shelter in King's Cross in Sydney, and then in social housing, unfortunately, when I was playing a role in evicting people into homelessness, and then over the last 10 years doing research. So it's fantastic to talk about this because I've always lamented the notion of managing homelessness and perpetuating more and more of homelessness, which unfortunately I think we all too often do. I'm going to say something that's very, very uncontroversial and perhaps you might argue is preaching to the converted, and that is I'm going to argue that we ought to end homelessness, of course, and perhaps if I was going to argue contrary to that, I wouldn't have got the invite. And that's kind of self-evident. I'm going to base that not just on practice experiences, but on a program of research that I've been involved in over the last 10 years with street outreach in Sydney, Brisbane, Darwin, Cairns, permanent supportive housing across Australia, also housing first models across Australia, and health models and homelessness shelters, where I'm also currently doing research, also with St Vincent de Paul and Salvation Army. And I want to say that because I'm saying some perhaps critical or controversial things about charity. So I want to make very clear at the moment, at the onset, that I'm not arguing against charities, but rather some of the things that are done in the name of charity, which I think are the antithesis to ending homelessness and thus things we should avoid. I'm going to say that we have morality on our side when we argue to end homelessness, but this is what perhaps really encouraging but also really frustrating, and that is we have the technical expertise. It's encouraging because unlike many social problems that we don't fix because we don't know how, I do indeed think, and we have evidence to substantiate it, that we can end homelessness, yet we don't. And we don't for a range of complex reasons, some of them to do with housing supply, some to do with technical problems, but some of them are about our normative assumptions of what the problem is and the way that we moralise or the way that we think about how we need to respond to overt forms of poverty. I'm going to argue that if we as a society or a system or a service provider don't end homelessness for someone we're working with or engaged with, we need to be able to substantiate and justify why we're not. Of course, there will be cases where we can substantiate that reason, but all too often, I think, if we have to justify why we're not ending someone's homelessness that we're paid to work with, our justifications will be a little bit slippery. And this is where I might get a little bit controversial. I thought, rather than just saying a whole heap of things that everyone's going to nod to, if I'm going to fly down from Brisbane for the day, I might as well try and say some things that are perhaps provocative. Are we not ending homelessness, I'm going to suggest in some cases, because of a poverty of ambition? Is it because we're motivated for responding to people in their deprivation because that makes us feel better? In addition to suggesting that we do have the technical expertise to end homelessness through permanent supportive housing and housing first, I'm going to argue at the very end that these measures do work and we should do them today, but when we need to use housing first, it's a sign that we have a demonstrably failed society. For people who end up living in the streets for years and years and years, that means we've done lots and lots of things wrong at many junctures throughout their lives. Why should we end homelessness? I actually agree with the speakers from this morning who said that housing is a human right, but I want to move beyond this idea of a human right, and I want to move beyond it for two reasons. One, there have been a number of countries across the world that have institutionalised housing as a human right, and they're countries that have massive homeless populations. So the rights discourse hasn't actually worked. Another reason is when we start talking about rights, we start getting into complicated debates about the Constitution, debates dominated by lawyers, and while we're having these debates, there are people dying on the streets. So I think we should argue instead about the consequences of homelessness. And there are lots, and when we think about the consequences of being homeless, these are the arguments for why we should end homelessness. Based on any notion of the kind of society that we want to have, where people can participate in society, we know that having a house is the necessary foundation, of course, for employment, but also for the capacity to be able to participate in family, to be able to take responsibility for caring for our family, for forming our own families, and this kind of inclusion in society, we need housing. And I think it was mentioned this morning by Reverend Arnold, when we think about the wholeness of a person, when we think about the complexity of people's lives, when we think about the nuance and interesting dimensions of people, it's very hard to do that when their poverty is on public display. When we see people as homeless, it's easy to see them as a manifestation of their deprivation. It's hard to see people distinct from the problems that confront us. And importantly, I'm going to argue that when we see this kind of overt form of poverty, it's easy to link this is what the person is. They're kind of the embodiment of this deprivation and these problems that we see. And this in turn makes it easier for us to have limited aspirations about what they might like to go and achieve. Really, when we think about what homelessness means, it means an absence of control, it means an absence of autonomy, it means an inability to be able to do what you want to do in life. And this is really, really evident not only in our research with people who are homeless, but our research with people who had lived on the streets for years, and we did research with them when they first moved into housing. And we asked them, is this new house for you home? And they said yes. And exclusively when people spoke about home, after having lived on the streets for 1, 2, more than 10 years, they explained housing as home because it created the conditions for them to control their lives. And they didn't really speak about voting or even raising children, although they did that a little bit, or participation in employment. They spoke about, I can go and cook some toast when I want, I can watch whatever telly I want, if I want to go to the toilet and have a shower, I can go when I want. Really, home meant a control of their lives. And this really brought home to us the inability to control one's life when people are homeless. And there's a lot of discourse about the Commonwealth Government should be promoting independence. And of course, as Karen mentioned this morning, we all live in an interdependent world. But when we keep people homeless, we actually create the conditions for them to be dependent upon us. I've done a lot of research with people living on the street, and they've often spoken about the positive regard they hold for the volunteers who come and help them. They're very conscious that these people are getting off their couch at night when they could be sitting there watching telly, and they're giving their time to come and give them tea or coffee or soup. And they really appreciate that. But on the other hand, they say, it makes me feel less than a decent person. By being reliant on this charity, it really reminds me that I have no capacity to control my life. And I really think we need to understand these kind of the way that homelessness is us making people dependent upon us. It's just also really efficient. It makes no sense to keep people homeless. We're doing research with a program in Northern Australia at the moment that's integrating healthcare with street outreach. And for a very large part, the health workers going out onto the streets are doing a really useful job. They're seeing a profound need of people with the most horrid unmet healthcare needs. But really their capacity to do much very useful is really constrained by the fact that they're working with people who continue to be homeless. And Michael Marmot really spoke about the causes of ill health. And that is, people in poverty are sick and it's because of their poverty. He talks about the social determinants of health. If we keep people homeless, there is no capacity for our health interventions to actually be able to treat those social conditions that keep them sick. Or as Doran and colleagues said in the US, housing is the best prescription a physician could write for a homeless person. And it really gets to the idea that if we're keeping people homeless, all the other things that we try to do with them are actually not going to work very well. We've also done some research, finished earlier on this year, with people who have moved into permanent supportive housing and they have access to healthcare. And we And we spoke to them about their experiences accessing healthcare, but really they couldn't talk about their experiences accessing healthcare in permanent supportive housing without comparing it to what it was like when they were on the street. And they spoke about not just practical barriers to accessing that mainstream healthcare, but they spoke about not feeling like they had the legitimacy to influence or to determine the type of healthcare they receive. They were very, very reflective and articulate and understood that physicians were just medicating them to kind of dull or nullify the symptoms of their poverty. They didn't feel like they had the voice and the authority to be able to influence the type of medication and treatment that their physicians could offer them. And these are the reflections of two tenants talking about, you know, I'll get to see a doctor. Sometimes the outreach medical workers would come to us, but really there was no capacity for them to do what I really needed. And they were very clear about that. Because of the consequences of being homeless and the solutions that we talk about and Jake and others have spoken about, if we're not going to end someone's homelessness, we need to justify why. And that's because we do have evidence in Australia. 10 years ago, we had to look to the US for the housing first evidence and some of the permanent supportive housing evidence. But in Australia, we actually have a relatively robust evidence base about ending homelessness. We know that purposeful street outreach is what's needed. Outreach where workers are going out there with the sole purpose of not mitigating risks, harm minimisation or comfort or having a chat, but going out there with the sole intention of ending someone's homelessness. We know that that works. And we know that some outreach workers have piloted and successfully achieved efficiencies within the system. For example, the barriers that people experiencing getting onto the social housing register. In Brisbane, there was a trial of outreach workers going out there with iPads that had housing applications where people could actually apply for social housing on the street, getting over some of those inefficiencies. Also, of course, and perhaps most fundamentally, addressing the barriers to accessing housing. We know that when street outreach is purposeful and deliberate but not linked to housing, it can be, as they say in the Northern Territory, humbugging, or it can be just coercive and punitive. But when street outreach is purposeful and when street outreach workers do have access to permanent housing, not more homeless accommodation, we know that this is not only a form of justice, but it's actually an effective means of getting people off the street. The research clearly shows that in the presence of ongoing support that's determined by the tenant, people who were on the street for years and years and years can actually sustain housing. I have the question mark there, not because I'm questioning support, but in addition to the challenges we have accessing housing, although the social housing system is able to provide a long-term affordable means, we really have very, very, very few mechanisms across Australia or policy infrastructure to provide ongoing support for people. It's remarkable how similar the evidence is from the United States, from Canada, and from Brisbane, Sydney and Melbourne. Brisbane with Brisbane Common Ground, Brisbane Street to Home, Sydney's Way to Home, Journeys to Social Inclusion in Melbourne and Melbourne Street to Home, and the large body of evidence from the United States. What we're seeing is the broad parameter of 80 to 90% of people are sustaining tenancies for anywhere between 1 and 5 years, as long as the research is going. The overwhelming vast majority of people are sustaining permanent, secure housing. And these are people who we otherwise thought were too hard to house or they weren't housing ready. And really the question now in light of this evidence is, are our housing systems ready to provide housing with them? It's not a question of, are the people ready? It's how flexibly can we provide access to the housing and the mode of support and the length of support and the nature of the support that's going to work for that individual. And as Jake said, in a very individualised manner. There isn't a one-size-fits-all. But what we do know, and what I think many practitioners in the room would know, is that an absence of support is a strong predictor of a failed tenancy. But what we need to do, and I think this has been a theme of today so far, is institutionalise access to housing. And what that means is we need to ensure that people have access to housing not on their basis of their status of being a client of a program. People need to be able to access housing that's affordable immediately on the basis of being a person, of being a citizen. We need to move beyond the pilots and the trials that we deliver around Australia. I've done too many research projects, or I've seen too many other research projects where there's a successful program here, a successful program there, Governments fund the program, and then often they'll fund the evaluation of the program, and then they'll see the 80 or 90% success rate. The governments will understand the critical features that contributed to that success. They'll go and talk to the tenants who will reflect upon their lives on the street who are now in housing, and then that pilot just dissolves. We need to institutionalise access to permanent affordable housing and the ongoing support. We don't need more trials. But more importantly, and I think this gets back to some of the poverty discussion from earlier this morning, people ought to be able to access housing, not just based on being a client or demonstrating they've got health problems. People need to be able to access housing on the basis of the citizenship. But of course, many people will be sitting around the room going, well, this is quite utopian. We would all like to end homelessness for everyone we work with, but the reason we don't is not our fault. We're a small NGO or even a large NGO, but we don't hold a massive portfolio of housing. We don't have hundreds of thousands of dollars to go and immediately access private stock from the market. But I think we need to reflect upon where the problems lie. And I think that is not just reflection, because reflection can be useful, but we then need to move from that reflection and shape it into action. Is it a lack of housing? Is the only reason we're not ending someone's homelessness as a service or as a society because we don't have housing? Is that the only reason? Often people will say that, and then as you talk longer, you'll see that there's a lot of other reasons tied into it. We need to articulate what the reason is. The wonderful Rodney Fopp, years and years and years ago, I think 20 years ago, spoke about bottlenecks and backlogs in SAP, and that is people in SAP were staying in there because there was no housing for them to get into, and people who needed SAP couldn't get in there because there were people in there who didn't need to be in there. Is that similar to what's happening today? And if it is, then we need to ask ourselves, when we're accepting the support dollars, do we need to change our activity to advocacy for more housing? Do we need to be focused much more on housing if the only problem we really have is an absence of housing stock? Or is it morality? Have we decided that some people just haven't done the things that they ought to do, that we suggest they need to do in order to access housing? Or are they just not deserving of housing? Now, I've often thought these deserving arguments, people often say, oh, this is still current today, and I thought, no, this was just a reality in the poor laws in England in the 19th century. No one actually really thinks people don't deserve housing today. And that's the problem if you just hang around with left of centre social workers and academics. You think that everyone thinks like you. But last Wednesday, I wrote a newspaper article in the Sydney Morning Herald, and I made what I thought were the most simple, obvious statements. And it was reflecting upon the Martin Place camp. And I said, a 24-hour safe space, that's what was being proposed. I don't even know what that was, but I said it's not a solution to homelessness. People are camping in Martin Place because we have insufficient affordable housing. I think this is not provocative. And I said we need immediate responses that involve secure and affordable housing, not temporary homeless accommodation or more charity. You can see that I was banging on about that last week too, but this is kind of a pretty straightforward kind of a statement, predictable for someone who does housing and homelessness research to say, I've got the link here, but it's not going to work very well. But what I've got here is a selection of some of the comments that people made responding to this outrageous assertion. I don't want to read through them because it makes me a little bit melancholy, but you can kind of get the gist of it that, in fact, for many, many people in society, perhaps, the reason we don't provide housing, or that we ought not provide housing, or the barriers to achieving housing, is in fact that they believe people's problems are their own. They believe that people have chosen their homelessness, that people are not deserving of housing because they haven't done the things that, of course, that they had done themselves. These are kind of really powerful narratives, and we need to understand that this is how many people think when we're trying to grapple with the technical solutions. So that person was Bender. This person is KK. This top comment is me reflecting upon what the assumption is, the assumption that people assume that they have no shelter, so any shelter will do, and if they say no, then they're choosing homeless. So that was me outlining what I think the argument that people have. And this is KK's response. You know, this kind of really almost in a fight with the person who's homeless, and this concern that that person who was homeless, living on the street, might get something that they've worked hard for. And this is kind of, I mean, I ridicule this, but it's important to understand that this is a view within society. But is it a poverty of ambition? Is it not just about deservingness and morality and not just about housing, but is it about a poverty of ambition? In the Northern Territory, I did a lot of research with people sleeping rough, who they were estimating there were 1,000 people a night sleeping rough in a city that has about 125,000 people. So if you look at the per head of population ratio, it's a higher proportion than LA. But they were not even referred to as homeless. They're countrymen. They're the long grassers. This idea that we don't even have an ambition that these Indigenous people in Darwin, in the long grass they call it, actually want housing. They just want to go back to community. No one's even grappling with the 30 people living in the one property and remote community and the profound and extreme poverty that underpins people's lives. It's this lack of ambition, this idea that people who are homeless don't want to go on and aspire to this kind of life. And if we go back to this idea that when we only see their overt deprivation on display, it's easy to kind of link in, to have this kind of thought process of they don't want anything more in life, they can't do anything more in life. But there's no more evidence of this poverty of ambition, I'm going to argue, than this new trend of the last couple of years, and it's really been a regression from the white paper and the housing first narrative from late 2000s to this kind of people are advocating for pop-up housing or last resort housing, or something that's making me really question the value of anything I've ever done. This new idea of going around and putting washing machines into utes and washing people, or mobile showers. This is not even a joke. This is actually really what's happening. Mobile showers or mobile hairdressers. This is an article that was in the Brisbane Times, which is the Fairfax version of the Brisbane paper. And it's essentially lauding and celebrating, this was from the weekend, the mobile hairdressers that go around. These are the northern parts of Brisbane. But what's profoundly distressing about this is not the fact that the fund is called Dignity First and they're not even trying to be ironic. This is funded by the Department of Housing. The Department of Housing now in Queensland, rather than funding housing for people who are homeless, is funding haircuts to people who are homeless, so they can be transformed. I don't know what kind of notion of transformation they're drawing on, but certainly that's not the one that we learn about when we're talking about justice and amelioration. But it's not just this kind of one-off version of a mobile hairdresser going around the northern suburbs of Brisbane that I'm taking too far. This Dignity First fund is actually a real fund of the Queensland state government. They're actually funding people to go out and wash their clothes, to clean themselves. And it's not just state funding. These charities then receive tax subsidies, which is a loss of revenue from the Commonwealth, to keep the homeless clean. I find it extraordinary. And really it only is premised on the assumption that the state government, Department of Housing, has said, well, we can't do anything about the homeless. We just need to keep them clean and looking smart. You know, I think it is. I think this is normalising their poverty. This is really normalising homelessness. And it distracts our attention away. 8 years ago, I was travelling down to the old Faxia in the day to talk about housing first and how we can have access to affordable housing, also talking with the sector and people at the state government about immediate access to housing and who's going to provide the ongoing support after 3 years. But now the state government's funding this kind of I don't know, continuation of poverty. Peter Singer, he's an Australian ethicist, which is a cool title, but he's also known as the most influential philosopher alive. He did some really controversial stuff around animal liberation in the 70s, and he's just come up with this new book called The Most Good You Can Do, and it's effective altruism. And he said, we need to assess with evidence and with rational thought the morality or the worth of what we do, and we should distinguish the benefits to the receiver from how good the giver feels. And he does some really controversial stuff that upsets lots of people. He says that it's ludicrous to spend, for example, $30,000 in the West training a guide dog when $30,000 can buy 300,000 malaria nets, and we know that one malaria net saves 4 children's lives. So he kind of gets into some really wild thinking. But the point of his argument is, whatever we do, be it through our tax dollars or through our volunteer efforts, we need to be able to demonstrate that it is the best thing to do on the basis of the benefit to those who's receiving it. I'm going to argue that providing washing machines might be a nice interaction for the volunteer and the person who's washing their clothes, but people can wash their own clothes in their own housing. We really need to be moving the debate beyond. We need to move away from this normalising and distracting response to rough sleeping, and we need to be assessing the worth of what we're doing based on the impact to those who are deprived the fundamental resources. And remember, go back to the consequences of being deprived. How am I going for time? 5 minutes. Okay. I'm going to talk a little bit now about, thanks for the segue into this earlier, Felicity, a study we did with Brisbane Common Ground. It's permanent supportive housing. It was built about 2012. There's 146 tenancies in here. Half of them were allocated to people who lived on the streets and the other half to low to moderate income. So it's permanent supportive housing. Everyone's got their own unit, self-contained kitchen, bathroom, toilet, laundry. But it has support workers on site. And we really wanted to, there was a lot of rhetoric around at the time about the cost of, say, ending homelessness rather than managing it. So we really wanted to test this assumption, but all of the research in Australia up until that point had been based on surveys, and it wasn't very reliable. In fact, it wasn't reliable at all. So we wanted to see whether providing people with a permanent tenancy in supportive housing had cost offsets compared to responding to them when they were homeless. So what we did, we got 41 tenants in this building who had all lived on the streets for at least 1 year before they moved in. And we got their consent to be able to access some of their data. So we accessed their data for a 24-month window. 12 months of that data, they were living on the streets, and the next 12 months, they were all permanent supportive housing tenants. So it's a very easy kind of a pre and post. And we wanted to see what kind of services they used when they were homeless compared to what they did when they were tenants of supportive housing, and we wanted to see how much those services cost. And you can see we're kind of doing a really simple kind of a mathematical comparison between how much it costs to keep people homeless compared to in housing. And this is really, really good data because rather than asking people about the services they've used, which is quite unreliable if you're going to go back a long time, particularly people who've used a lot of services, we actually went into the Department of Health and we got emergency admitted, mental health, and ambulance. We went to police and got offences, nights in the watch house, victims of crime. We found out anytime someone went to a court, anytime they were in prison, probation, parole, also anytime they spent homeless accommodation. So we got all of this data and ethics approval. I was a very young man when we started this process, but it took 2 years to get the ethics and the data custodians in these organisations, some of which could do this, spit this data out in about 15 minutes. So technically it was really, really easy to do it, but it was actually a long process to try and get this data. So so for the 41 people, we got their informed consent to be able to access the data. Anytime they had any interaction with any of these for 24 months, we found out whether that interaction was when they were homeless or whether they were in supportive housing. So this is the kind of stuff we did. So this is for mental health. This is the 12 months when they were homeless, 1,029 episodes of mental health, or 27,152 minutes, and we can see it changed to 359 episodes when they were in housing, so a reduction of 65. What's really amazing about getting health data is that health departments don't only have really, really seriously good data about everything they do, they also cost it. They know exactly how much a plaster costs if Cameron goes in and gets plaster, and they know how much it costs whether I got it in Brisbane or in Cairns. So they have the exact dollar. So these are not indicative figures. These are exactly what Queensland Health know they spent on these mental health interactions. So we did this also for the police, and this is really, really interesting, and interesting for ways that go beyond cost, and we'll talk about that at the end if I'm not going to run out of time. We can see that occurrences as an offender went down, victims of crime went down really importantly, stays in the watch house went down, and to keep vaguely in line with time, we can see that there was about an $81,000 reduction for our 41 individuals if we're talking exclusively about the police. So we did this for all of our data sources, admitted patients, mental health, emergency, ambulance. And you can kind of see the story here. I'm going very, very quickly because I know I'm running out of time. When people were homeless, this is not indicative figures, when people were homeless, they used $1.976 million worth of Queensland government-funded services in a year. When they were tenants of permanent supportive housing, they used about $852,000. So the reduction is a really significant reduction. This is 41 people. And of course, the level of mathematical analysis in this is maybe grade 9, grade 10, but the power of this analysis has been phenomenal, but the sophistication is really, really, really low level. We just added stuff up and we compared them. And then we did some averages. So we see that if we get our 41, they each used about $48,217 in Queensland government-funded services based on our administrative data when they were homeless. but they used only 20,000 when they were permanent supportive housing tenants. But then people will go, oh, wait a minute, but you had to pay them you had to pay for the housing when they were tenants. Absolutely. It cost us $14,000 as a state, a society, to provide that housing. So we have to add the 14,000 that we spent in housing to the 20,000 we spent in all those other things. And we can see that it comes up to 35,000 we spent on average each person in a year. And of course, then you know exactly what we did. We compared that cost, and we can see that it was, as a state government, now this is the most minimal. We're not adding any value to one's life. We're not talking about how much it costs to keep someone homeless compared to ethically, or what it might mean at a more serious level. This is just really costs that the state government spent. So it cost us, as a state government, $13,100 per year on average to keep someone homeless, compared to what it costs to keep them in permanent supportive housing. There are lots of things I could say about this. One is there's been a lot of, this makes us think about ending homelessness, and it goes back to perhaps the comment about when people move states or move regions. Ending homelessness is not the responsibility of one department, because as soon as it is, Department of Housing are going to go, we're spending all this money on supportive housing so that police and health and corrections save money. This is a whole state government proposition. But what we also found was that many people's lives didn't change. Many people were still unemployed. They still reported active addictions. They still reported psychological distress, although some of those things improved. But how they lived their lives demonstrably improved. And this isn't just kind of us theorising that when people are homeless, they're going to do these kind of things. This isn't just us drawing on sociological theory about socially mediated action. What people do is a product of the resources and their environment. We've actually demonstrated that. When people have access to housing, they're no longer turning up to the emergency department. They're not staying in as an inpatient longer than they have to because they've got a house. They're not being picked up by the police for, things that the police, frankly, are not interested in. Public urination, petty crime. Their lives change, what they do. If we can go back to this kind of normative idea of the identities we impose upon people when we can't see their wholeness, if we think about who they are, when they're tenants of supportive housing, they're just citizens or they're tenants. They've moved from being homeless people or clients or patients or offenders. They're not these things anymore. These are not identities we can ascribe to them. They've gone to being people. So this is a really normative, fundamental shift. Last two slides. Is that okay? Support is often required. We know, all of the research shows that if we just cut support off for people who've been living on the streets the longest, they're probably going to return back to homelessness. So support is required, and for many people, it's going to be necessary for a very long time, if not for the vast majority of their lives. We don't have mechanisms to enable that, but often people don't want that support. Many people would say to me, I just want someone in my life who's not paid to be there. They want that informal support. And there was a point that it occurred to me when I was listening to a TED talk from a solicitor who works on death row in Alabama. And he said, after doing this for 20 years, I could write the biographies of 10 inmates who are on death row, and I'd meet them and I'd get 8 right. And I thought that's exactly the same with the research I'm doing with people who lived on the streets the longest. I could write their biographies, and 8 out of 10 times I'd be right before I'd even met them. And those biographies would start with serious harms as children, out-of-home care, often failed out-of-home care placements, juvenile justice, incarceration, long-term employment. People really aspired to this normative kind of life that they hadn't achieved. And the reason support was necessary but not desired was because they wanted to move out of this system of just being a client. They wanted this normality in their lives, as hard as that was to achieve. And that's the point, is that if we go for housing first and permanent supportive housing, and we should, we're only doing so because of these seriously failed lives that we've enabled. And these are not people that have not been known to the state. The state's known about them through our child protection systems, through our housing systems, education, our health systems, our criminal justice systems. And when we do those in a really, really suboptimal way, for a very small cohort of people, we then need to think about housing first 40 years down the track. So to conclude with the last slide, we should immediately end a person's homelessness with housing, permanent housing that's not homeless accommodation. But we really need to think about structural change to disrupt the problems that manifest in deep exclusion. So structural change that ensures people are not just going to be harmed as children and then not supported and then put into failed placements because the placement wasn't supported and then failing at school because the education wasn't there. We need to change the trajectory of people's lives, and we need to institutionalise access to housing that's affordable and support, if necessary, based on people's status as a citizen, not as a client of a program. That's it. Thank you very much.
Now, there may be one or two questions for Cameron. Are there any questions? Yep, there you go.
Hello. Over here.
One over there and then down the front. Yep.
I'm happy. My question relates to private rental stock and Airbnb. In Australia, in less than 10 years, there's now 115,000 Airbnb listings, and in South Australia we have about 3,000 plus. And it was actually established on the premise of just renting a room out in your own home, but now nearly 60% of those listings are not owner-occupied. So we've got less private rentals and less availability for long-term renters, plus that's having an impact on the cost. So is Airbnb a challenge? And if it is, to the housing stock and to the homelessness sector, etc., how do we address this?
Simple question.
Yeah. I don't have evidence to substantiate. I interviewed someone from Housing Tasmania a month ago, and she said anecdotally in Tasmania with the boom in tourism that there is a lot of affordable private rental stock that's leaving the market, and that the reports are that that is having a detrimental impact. I think it goes back to the earlier point that in the context of a social housing sector that's about 3% of, or 4% in South Australia, I think, is it 5% here? It's about 4% anyway in the whole of the country. When we have a social housing sector that's so small, changes to the private rental market, for example, in the way you described, absolutely going to have a negative impact upon housing that's accessible for people who are on the lowest income quintiles. We really need to demonstrably enhance the supply of housing that's affordable for people who don't have very much money. In addition to anyone who's on New Start, we know cannot afford to live in private rental, and if they do, they should get some kind of medal because no one can figure out how they could. So in addition to the amount of income that people who are on New Start receive, we also need to massively increase the housing stock that's available. And I think just about anyone who does housing research would say the same. And I think that relates directly to your question because, yes, it does have an impact in that context of not much else available.
Hello. Thank you for the presentation. That was excellent.
Thank you.
I'm interested in the cost of the $14,000 cost of keeping somebody in there. How does that break down? Is there a bricks and mortar proportion of that, and then the support proportion? I'm just interested.
So that 14,000 includes the cost of providing the tenancy and also the support, and that's going to vary depending on the support and the housing. But I think
that's a lifelong kind of $14,000 every year for...
That's a lifelong for the housing cost, but we don't know what people's trajectories are going to be like in the second and third year, nor do we know what their trajectories were like before that year they immediately ended homelessness. What we do know is that this relates to people who are really experiencing significant and multi-dimensional problems in their lives. This is not just most people are homeless. And the reality is that for most people who are homeless, it's probably not going to be cost effective. We should end their homelessness for the reasons I outlined in the first few slides. But I think what's really powerful about the argument is that when people are homeless, we're going to spend money. So do we want to spend money locking them up and driving them around in an ambulance and them going to the emergency department, or do we want to spend money in permanent supportive housing? I think everyone would argue that it's the latter. So the cost argument, I always try to nuance it by saying it's much more a statement about where we as a society want to spend money, and we have to understand that when we keep people homeless, in addition to the gross injustice, it is also an inefficient use of our taxpayer money. So I hope that's a useful answer.
Great.
Thanks.
Cameron, I wanted to ask a question around your work in the Northern Territory, and of any of the information that you've presented today, is there anything different that you would say about Aboriginal experience of Aboriginal homelessness and the Housing First approach, or in what you've been speaking to today? So 30% of our clients are Aboriginal, and we're struggling with one size, one approach. So I don't know if you could make some comment on that.
I would love to. I would distinguish the research we've done with Indigenous people who live in our major capital cities, and what we've found is that Housing First absolutely works well. And what we've also seen some evidence that we know that cultural responsibility of having family over all over Australia ever since housing's been provided has been a risk of tenancy failure. We see that some people who are Indigenous in permanent supportive housing in Brisbane Common Ground are actually using the concierge, are using the on-site security as a means to deflect that cultural responsibility. That is, it's the white fella down there won't let you stay. So they're actually using the facilities of permanent supportive housing to respond to that cultural obligation, because lots of research from Paul Memmott and others have shown that the people who are having their family over know that that's putting their tenancy at risk, and they'd rather not do it, but they know they have to do it. So, and I think there have been examples in North Queensland previously where the housing officer was always the one that would come around and try and get the family out because they knew the tenant couldn't do it themselves. In the Northern Territory, the housing deprivation is just at another level. People talk about the 1,000 estimated people in Darwin who are sleeping rough, and we really can't even vaguely understand that as cultural mobility. It really is about extreme and profound third world condition housing in remote Indigenous communities where there are way too many people in there. And people are leaving for lots of reasons, but the lack of housing, the lack of money, and some of the restrictions on their lives. But fundamentally, it's about those just third world-like conditions in remote Indigenous communities that explain. We see the same in Cairns from the Gulf and the Cape and in Darwin from the desert and the islands. So really people are moving into Darwin, and it's assumed to be cultural mobility, and there is a dimension to that, but we have to understand that response in the context of the severe overcrowding. And when we speak to Housing Northern Territory, rather than talking about housing first, they're talking about they've been drilling in some communities to try and find water, and until they find water in some communities, they can't actually do the groundworks, which will then lead into building new housing. So it's such a different paradigm to what we're thinking about in our major urban centres or even most rural Australia. But I think Housing First would work. If Housing First is immediate access to housing and support that's voluntary, I think Housing First works perfectly for Indigenous people.
One more question. Any more questions? Go. Yep. Wait for the mic.
I'll start by saying this is not my industry, so I might be asking a question that you all know the answer to. I'm assuming we're talking about CBD. Are we talking about people in cities? Are these statistics for rural and country?
No, this is for inner city Brisbane, so this was a Brisbane Common Ground. Yeah.
So we have like a decline in our country communities. We have a decline in people wanting to be out there, and I go for drives with my family and I see closed houses after closed houses and communities shutting down and general stores shutting down, and I've seen some things where refugees have been placed into those communities and they've brought communities back to life. Are we doing anything with that model for homelessness? Is there a way that we can be tapping into houses that are already built and communities that are already there that just actually need the people?
I think there are a lot of people talking about that, particularly in Queensland and perhaps northern Western Australia, where there's been the mining downturn, and certainly around Geraldton and other towns in North Queensland, there are now houses that are vacant or houses that they can't rent out. There isn't a serious conversation that I've heard anyone in government about it. I think there is hope for optimism there, but on the other hand, we know that moving people outside of centres where they have their supports or where they have services might be just exacerbating the problem, but having it in a different manifestation, that is experiencing poverty and exclusion, but in a house somewhere in the bush. So I think there is potential opportunities, but I think people are reluctant because they understand some of the social consequences that may realise. That's it.
Okay, that's we're out of time, but I think you can see why we wanted Cameron to address you. And I'll take the question, Cameron, do you do a stand-up show as a comment?
What sort of stand-up show, Peter?
Please join me in thanking Cameron.